So in this video, I'm going to concentrate on non-surgical eyelid lift or blepharoplasty and non-surgical skin tightening using Plexr or plasma. So Plexr was the prototype device that came into the market in Europe about 17 years ago and came to UK about 4 years ago. And I've had the pleasure of being the first oculoplastic surgeon that started using it in UK, and I have extensive experience using Plexr or plasma in the upper lid to tighten the upper eyelid skin and the lower eyelid skin. So where would I use plasma in my practice? Ideally for patients who present to me with mild to moderate loose hooded upper eyelids or excess eyelid skin. I find this an excellent device that allows me to tighten the skin in real time. The patient is awake, we're chatting, and I can modulate my treatment to give the patient the kind of bespoke upper eyelid lift they require. I also particularly like the use of plasma to perform an extended skin blepharoplasty, particularly for these kind of hoods that extend, laterally, for the smile lines or the crow's feet, and for even creating a bit of a vector-like brow lift. I find that this is an excellent device, particularly if you're treating loose skin that's responsible for the presentation. So in a nutshell, why should you be considering having a non-surgical blepharoplasty? Well, why do my patients consider it? They're scared of having surgery. They're scared of the downtime of surgery. They're scared of the visible scars of surgery. And often they don't have the budget to have an invasive surgical procedure. And they choose to come to clinic, spend approximately 20 minutes with me, having some skin tightening. It's very common for them to come and see me on a Friday. They recover over the weekend because you do get quite swollen for 2 days after the treatment, and you have these little brown crusts and scabs on the upper eyelid or the lower eyelid for 4 days to a week, which can be covered with makeup, and they can go back to work. I'm finding now, having performed Plexr blepharoplasties for more than 3 years, is that most patients, after they've completed a course and got their optimum outcome, come back to me perhaps at 18 months to 2 years to just have one more skin tightening procedure on their upper lid. So they're not coming back annually, but they're perhaps coming back every 1.5 to 2 years to have some further skin tightening. Another common question I get asked is, can I have a surgical upper lid blepharoplasty, or will the results of this Plexr blepharoplasty interfere with the surgical results? And absolutely not. I've performed surgery on patients who chose to go down the surgical route after having had plasma or Plexr blepharoplasties elsewhere, and it hasn't really interfered with their final surgical outcome. If you have any further questions, please don't hesitate to contact my team at Perfect Eyes Limited.